I have a hypothetical situation for you. Say you have an accident and fixing it would require a complicated surgical procedure. Do you A, go to a hospital, B, ask your friend to do it, or C, go for it yourself? Calling this a hypothetical hardly even makes sense. Unlike other forms of medicine, there really is no DIY alternative when it comes to surgery. But that hasn't stopped people from trying. The year is 1944, in the brutal heat of summer in a World War II-stricken Philippines. Stranded on Mindanao Island, Australian Army officer Robert Jock McLaren knows he has appendicitis and is going to die if he doesn't do something. His medical experience is limited, at least when it comes to humans, and his operating tools include a pocket knife, a mirror, and jungle fiber, whatever that is. 4.5 grueling hours later, somehow, he successfully removes his own appendix. In 1998, Jerry Nielsen was the only medical doctor at the Amundsen Scott Research Station of Antarctica. It was in winter of that year when she would unfortunately discover a lump on her breast. The most common way to find out if such a lump is cancerous is to perform a biopsy, which involves removing a small amount of skin to perform tests on. As the only doctor at the station, she had to perform this procedure on herself. The lump did turn out to be cancerous, but she was able to get chemotherapy drugs airdropped to her right away, and her own quick thinking may have saved her life at the time. Both of these people acted out of sheer necessity in incredibly pressing situations. The next person I'm going to talk about shows similarities to the first two, but they also were in a place where they had access to professional help. In short, this is a story about an incredibly stupid decision. In 1979, an unnamed medical student called 911 for transport to a hospital. It was found that they had attempted to inject a combination of questionable substances into their body, and they didn't want to tell the authorities what they had been doing. Everything had been going as planned until one small mistake with the injection site. Now the substance would have to be removed or else risk causing infection. So, at 4 in the morning, the student disinfected their dorm room and draped off a corner with sterilized bedsheets and a few strategically placed mirrors. 8 hours later, the student was remarkably still conscious enough to acknowledge this wasn't going to work, and stitched themselves up before calling 911, exhausted and defeated. They would later undergo a second, successful surgery. So, moral of the story, if you need to see a doctor, do it. You'll save anywhere between a few hours and the rest of your life. Thanks so much for watching. Drop a follow and send to a friend if you enjoyed. I appreciate your attention.